Today I will be teaching upon the topic malignant melanoma, and this topic is for BSc second years for MedSearch. So malignant melanoma, it is a part of the skin cancer. Okay, so let us see what is skin cancer all about. So skin cancer is the most commonly diagnosed cancer. Okay, apart from all the types of cancer, the skin cancer is one of the most commonly diagnosed, and it is either non-melanoma, meaning that, so there are two types, it can be non-melanoma or melanoma cancer. Okay, so a persistent skin lesion that does not heal is likely suspicious for malignancy, and it should be examined by the healthcare provider. So if a skin lesions on the body, okay, if there's any rash or any lesions on the body, it should be, and if that lesion does not heal, then they can be suspicious for malignancy of the skin cancer. Okay, so as you can see here, these are some pictures. Okay, these are skin cancer. These lesions, okay, which does not heal, and they become their skin cancer. So early detection and treatment can often lead to a highly favorable prognosis. So it is better to detect them fast and then provide treatment as early as possible, so that there will be favorable prognosis, meaning that the patient will come back to the normal stage. Next, the visibility of the skin lesion increases the likelihood of early detection and diagnosis, meaning that these small skin lesions, okay, they will grow more and they will become more visible. Okay, so it can start from a small lesion like this, and it can grow and become to a big, like a big melanoma or big non-melanoma skin cancer. Okay, so it can start from here, it can grow to here, and it can come like this. So therefore, it is very important to detect, to check, okay, to see if any part of your body, if any lesion is present with and it does not heal, meaning that it can be skin cancer. Okay, so it is very important that skin cancer, okay, it can be non-melanoma or it can be melanoma. So coming to the risk factors for skin cancer, how skin cancer, like who are at a higher risk for skin cancer? Okay, so people who are exposed to the ultraviolet rays, okay, then any damage in the ozone layer. Okay, so if there's any damage in the ozone layer, then the harmful ultraviolet rays can get in contact with the skin and can lead to skin cancer. Next, fair-skinned and fair-haired people due to insufficient skin pigmentation. So people who are fair, okay, people who are fair-haired people, meaning who are fair, okay, so they are at a higher risk for developing skin cancer. Why? Because of lack of skin pigmentation in their, because of the pigmentation is very less in their skin. Next, prolonged exposure to sunlight. So if the person is being exposed to sunlight for a longer duration, then that also can, she can develop skin cancer. Next, person exposed to pollutants, chemical pollutants like arsenic, nitrates, coal, tar, and pitch, oils, and paraffins. So they are at a higher risk for developing skin cancer. Next, history of X-ray therapy for acne or benign lesions. Patients who had taken X-ray therapy, okay, for acne or for any lesions, then they also are at a higher risk. Next, scars from severe burns, chronic skin irritation, immunosuppression, meaning that the immune system is very low, okay, and genetic factors. Okay, so genetic factors also plays a very important part in skin cancer. Okay, where the defective genes can be transmitted from the parents to the children, parents to the offspring, from the offspring later on to their future generations. So these are some of the risk factors for skin cancer. Now coming to the types of skin cancer. Okay, so there are three types. One is Basal Cell Carcinoma, which is short form for BCC. Then second is Squamous Cell Carcinoma, SCC, and third is Malignant Melanoma. Okay, so let us see what are these, let us go deep into these types of skin cancer. So first, about the basal cell carcinoma. Okay, so it is the most common type of skin cancer. It appears on the sun-exposed area. So if person is sitting under the sun for a longer duration, okay, then this type of carcinoma cancer can it appears on the exposed areas, okay, and it is more prevalent in regions where the population is subjected to intense and extensive exposure to the sun. So this type of cancer is very common in those countries where people they like to sit under the sun and get tanned. Okay, so they are very much exposed to the sun rays. So therefore, these skin lesions they are most present in such people. Next, the incidence is proportional to the age of the patient and the total amount of sun exposure, and it is inversely proportional to the amount of melanin in the skin. So, meaning that as the age increases, okay, as the age increases of the patient, then this carcinoma also will start increasing. Okay, they will develop more in the adult patient as compared to the children. Okay, and it is also proportional to the total amount of sun exposure. So, like I said, that the more you are being exposed to the sun rays, the high risk that you will develop basal cell carcinoma. And it is inversely proportional to the amount of melanin in the skin, meaning that it is just the opposite. If melanin if melanin pigmentation is more in the skin, meaning that this type of carcinoma is very less. Okay, so increase in melanin will lead to decrease in the formation of cancer or basal cell carcinoma. Okay, so here it is the incidence of basal cell carcinoma is directly proportional to the age of the patient, meaning it is directly proportional to the age. If age increases, then this type of cancer also increases. Next, to the amount of sun exposure, meaning that the more duration you are being exposed to the sun, the higher the risk that you will develop skin cancer. And third is inversely proportional, meaning that it is just the opposite. If melanin increases, meaning that this type of cell cancer there will be very less chances to occur. So as you can see in these pictures, okay, so this is basal cell carcinoma. So these are some of the pictures of the basal cell carcinoma. Now coming to the second type, that is squamous cell carcinoma. Squamous cell carcinoma, it is a malignant neoplasm of keratinizing epidermal cells. Okay, so malignant meaning that it can have the tendency to spread to the surrounding tissues. Okay, so it is a malignant neoplasm of keratinizing epidermal cells. It frequently occurs on sun-exposed skin. So whichever portion of the part of the skin it is being exposed to the sun for a longer duration, there at that area only this type of carcinoma will appear, or at the base of the skin lesions, or wherever the skin lesions are present on the skin and they do not heal. Okay, so those areas they may develop this type of cancer called squamous cell carcinoma. So squamous cell carcinoma is less common than BCC. Okay, so which is more common? It is the basal cell carcinoma as compared to the squamous cell carcinoma. Squamous cell carcinoma can be highly aggressive. It has the potential to metastasize. Okay, so it is very aggressive, meaning that it can, because it has a tendency to go and spread to the surrounding tissues. Okay, so that is why it is very dangerous, and this can lead to death if not treated properly and at the right time. So if proper medication or early detection and proper medication is not being given to the patient, then this type of squamous cell carcinoma, it can metastasize, it can spread, and it can spread to different parts of the body, not only to surrounding tissues, but gradually it will go and spread to the different parts of the body, like to the brain or to the lungs or to the kidneys, and this can cause death, or it may lead to death. Okay, so So squamous cell carcinoma is more deadly than basal carcinoma, and basal carcinoma, it is more common than squamous cell carcinoma. And you can see the picture here also. Next, coming to malignant melanoma. Okay, so this is a very important topic for today. Okay, as compared to the other skin type of diseases, skin cancer, malignant melanoma is a very common, it is very important topic of the skin cancer. So I will focus more on the malignant melanoma today. So a malignant melanoma is a cancerous neoplasm in which abnormal melanocytes are present in the epidermis and dermis layer. So these abnormal melanocytes, okay, they are present where in the dermis and in the epidermis layer of the skin. So, and these abnormal melanocytes, these are cancerous. Okay, so there is abnormal growth, fast growth. Okay, the nucleus is different. There will be dark features of the nucleus. Okay, then it has a tendency to go and spread to the surrounding tissues, meaning that it has the function of metastasize. Okay, so it is the most lethal, meaning it is the most deadly or the most dangerous of all skin cancers. That's why I am focusing more on this topic. Okay, on this malignant melanoma. Why? Because it is the most deadliest type of all the skin cancer. Okay, most melanomas arise from cutaneous epidermal melanocytes. Okay, so the main origin, okay, from where it can arise or from where the cancer cells will grow is from the cutaneous epidermal melanocytes. Okay, that is the place of origin where the cancer cells can grow. Next, coming to the risk factors. So you can see here the picture. Okay, this is malignant melanoma. Okay, the color of it is dark. It can be like black or purple. Okay, and this is the this is the picture, and this can spread. Okay, it can spread to the surrounding tissues. Okay, it metastasizes to the surrounding tissues and the parts of the body. So that is why it is most deadly skin cancer. What are the risk factors? Number one, the cause of malignant melanoma is unknown, meaning that there is no specific cause why this type of skin cancer is happening. Next, ultraviolet rays are strongly suspected based on the indirect evidence such as increased incidence of melanoma in countries near the equator. So ultraviolet rays may be, okay, so these are, it is one of the risk factors. It can be one of the cause for this type of malignant melanoma, and people living in countries near the equator. Okay, so those countries near the equator, people living in those countries, they will develop more of this malignant melanoma. Okay, and the third risk factor is family history. Okay, so genetics play an important part here. Okay, so the defective genes, okay, they will be transmitted from the parent to the offspring and further to the future generations. Okay, so these are some of the risk factors. Okay, so remember the risk factors for malignant melanoma are ultraviolet rays and number two, family history or genetics. Next, coming to the clinical manifestation. Okay, so first is superficial spreading melanoma occurs anywhere on the body. So like I said, malignant melanoma, it spreads. Okay, so it spreads superficially anywhere on the body. Okay, so it is like this structure. It usually affects the middle-aged people and occurs most frequently on the trunk and lower extremities. So the middle-aged people, okay, the adulthood, that is the age which is more prone to having this malignant melanoma. Okay, and it occurs mostly on which type of which specific region of the body, that is on the lower extremities. Okay, it can be the thighs, it can be the legs, thighs, the toes, or on the trunk, meaning at the back, okay, on the buttocks and the hips and the back. So these are some of the regions where this type of skin cancer is occurring. The lesions extend to be circular. Okay, what type of structure? They are circular with irregular outer portion. Okay, so as you can see here, they are like circular structure. Okay, but it is irregular. Okay, so it is not a full circle, but it is irregular circle, irregular outer portion. Okay, so here also you can see it is irregular. It is not full circle. Next, the margins of the lesions will be flat or elevated and palpable. So the margins. Okay, so these margins here, they can be flat, they can be elevated. Okay, they can be elevated. As you can see here, it is elevated and it can be palpable. So these are the signs and symptoms of malignant melanoma. Next, the malignant melanoma may appear in combination of colors. Okay, so it may have different colors. That is number one. Okay, with hues of tan. Okay, it can be like tan is a brown color, you can say. Okay, brown, black mixed with gray, or blue, black, or white. Okay, sometimes a dull pink rose color can be seen in small areas within the lesion. Okay, so this dull pink rose color also can be seen. That will be the color of the lesion. And there are many colors like black, which is mixed with gray. It can be blue black in color. Okay, so as you can see here, okay, so it is like blue black. Then it can be white or it can be brown. So these are some of the signs and symptoms of malignant melanoma. Okay, so as you can see here, this is like dull pink rosy color. Okay, this is black which is mixed with blue, and you can see some of the brown color at the edges. Okay, so that is malignant melanoma. Next, coming to the assessment and diagnostic methods. So first is the excisional biopsy specimen. Okay, so biopsy will be performed in this type of malignant melanoma, where when the suspicious lesion is too large to be removed safely without extensive scarring. So excisional biopsy specimen or incisional biopsy will be done. Okay, so that we will remove a tissue of the malignant melanoma and send it for investigation. Next, chest X-ray, complete chest X-ray. Okay, then we will also perform a chest X-ray if the malignant melanoma will spread to the lungs or spread to the upper part of the body, the chest area. Then complete blood cell count, then CBC test, liver function test, LFT, KFT, radionuclide or CT scans are ordered for staging once melanoma is confirmed. So CT scan is performed for confirming the stages of malignant melanoma, to confirm the stages of skin cancer. Next, coming to the medical management, the therapeutic approach to malignant melanoma depends upon the level of invasion and the depth of the lesion. So the therapeutic approach, meaning that how much medicine we have to give, it depends upon the level of invasion, meaning depending upon the stages of the cancer, and it depends upon the depth of the lesions, how deep it is going, whether only in the epidermis or the dermis region, or is it penetrated to the subcutaneous tissues or to the muscles and to the bones. Okay, so that also it will depend. Okay, next, in addition to surgery, chemotherapy and induced hypothermia may be used to enhance the treatment. Okay, so because it is cancer, okay, so it is cancerous cells, therefore we will, apart from the surgery, chemotherapy also will be given to the patient, and induced hypothermia also will be given to enhance the treatment. Next, investigators are exploring the potential for the use of lipid-lowering medication. Okay, so these medications, lipid-lowering, meaning to reduce the lipids or the fats. Okay, and these medications are also used, and vaccine therapy to prevent melanoma. So there's a vaccine also which can prevent melanoma. These also are being used. So these are all under medical management. Next, surgical excision is the treatment of choice for small superficial lesions. Okay, if the lesion is very small, okay, so if the malignant melanoma is very small, then surgical excision, just surgery or to remove the whole tissue, that is being done. Next, deeper lesions require wide local excision. So if the lesions have penetrated really down, okay, to the muscles and to the bones and to the subcutaneous fats tissues, then it requires a wide local incision surgery, after which skin grafting is necessary. Next, regional lymph node dissection is commonly performed to rule out metastasis. So, to stop the process of metastasis, the dissection of the regional lymph nodes, whichever lymph nodes are affected, we will try to remove the lymph nodes. So regional lymph node dissection is commonly performed to rule out metastasis. Just so as to prevent further spreading of this cancer, we will try to remove the affected lymph nodes. Next, immunotherapy. Monoclonal antibodies directed at melanoma antigen. So in immunotherapy, medications, okay, like monoclonal antibodies will be given. Next, autologous immunization against specific tumor cells, that also will be given, okay, that is a vaccine. And third is chemotherapy may be used for metastatic melanoma. So like I said, chemotherapy will be given, immunotherapy, okay, and these vaccinations, okay, autologous immunization vaccines will also be given to against these malignant melanoma. So that was the medical management. Surgical management is the surgical excision, and if it is being spread more deeper, then we will use a wide local excision. And if the lymph nodes are affected, then we will remove the lymph nodes, affected lymph nodes, so as to prevent the spread of the cancer cells. Now coming to the nursing diagnosis, acute pain related to surgical excision and grafting. Okay, so because it is a surgical procedure, therefore the patient will be having pain. Anxiety and depression related to possible life-threatening consequences of melanoma and disfigurement. Because, like I said, this type of malignant melanoma, it can be transmitted from the parents to the children and then further to the grandchildren and all that. So it can spread from among the family members as well. So it is a genetic hereditary disease. Therefore, patient will have anxiety and depression. That because of my disease condition, my future generations also will be having the same disease condition. So there will be anxiety and depression. Next, deficient knowledge about the early signs of melanoma, regarding the signs and symptoms of melanoma. Okay. Next, risk for infection related to break in the skin barriers. Okay, there can be chances for infection. Therefore, this diagnosis is applicable to malignant melanoma. Now coming to monitoring and managing most potential complications. Okay, if there is metastasis, meaning that it can have the tendency to spread from its original place to the surrounding tissues and further into the other parts of the body. So to prevent or to manage such complications, okay, first we have to educate the patient about the treatment and deliver the supportive care. Okay, we have to educate how to take the medicines and what are the purposes of medications, all that we have to educate. Provide and clarify information about the therapy and the rationale for its use. Identify potential side effects of the therapy and ways to manage them, and instruct the patient and family about the expected outcomes of the treatment. So full information about the about the chemotherapy, what are the actions, what are the side effects of chemotherapy, and what are immunotherapy, what are the vaccines that are available. So all this information has to be given to the patient. Monitor and document symptoms that may indicate metastasis, such as so we have to monitor, we have to check for signs and symptoms. If the cancer cell is being spread to different parts of the body, okay, for example, if the cancer cell is spread to the lungs, then we have to check for the signs and symptoms such as difficulty in breathing, shortness of breath, increasing in cough. Okay, so if the cancer cell is being spread to the bones, then you have to check for pain, okay, pain in the joints, decreased mobility and function, okay, not able to bend properly, not able to do proper flexion and extension exercise, or pathologic fractures, meaning that patient is having recurrent fractures, then also you have to check for the assignment center. And if the cancer cell is being spread, okay, it is metastasized to the liver, then we have to check for the signs and symptoms, that is change in the liver enzyme levels. We have to check for jaundice, okay, any yellow discoloration in the skin and mucous membrane, and also we have to check for pain. Okay, so these are some of the the nursing intervention or the nursing management so as to prevent such complication, that is metastasis. Then another point is encourage the patient to have hope in the therapy while being realistic. That means positive, supportive, positive thinking and positive help should be given to the patient so that they will not be demotivated. Okay, so they will, so that they will have hope and not be demotivated in the therapy that they are taking. It can be immunotherapy, it can be chemotherapy, or the antibodies or the vaccinations. Then provide time for patient to express fears and concern about the future. Okay. Then offer information about the support groups and the contact people. Okay. By having support groups also, they will be motivated. Okay. And arrange for hospice and palliative care services. So these are some of the nursing intervention, okay, that we have to provide to the patient in order to prevent metastasis. That is one of the main the potential complication of malignant melanoma. So I hope this is clear about malignant melanoma, which is a skin cancer. Okay, and also the other types of skin cancer. So thank you for the class.